Hi, Steve Adler. Got a minute? All right, so we're going to go over the virus numbers here tonight. Touch on a couple things that I think indicate a brighter future, and then a really cute picture at the end. Let's begin with the first numbers that we have. Let's look at the chart that we have always been looking at, and we're watching this number come down. Look at that graph in the middle. That spike that had us going from blue all the way up to red happened in the course of is like less than a month. We went from blue to red. If we hadn't been able to react as we did as a community, we would be off this chart right now. So congratulations for doing that. Please don't take your foot off the brake. If we're going to lower the virus load in our city, we can't let up. That's what other cities do. That's what we did. Let's keep wearing masks. Let's do the social distancing. Let's avoid the really big groups, and let's drop the virus farther and farther down so we have a better chance of holding on to open businesses, better chance of sustaining schools. Let's look at the numbers. Today, the number of new admissions, 58. Remember, there was a day not too long ago we went over 100. 58 is where that number is right now. Our 7-day running average is 60.6. Remember, we were looking at going over 70 and looking at potentially having to do something drastically. We've now dropped down more toward the middle of getting closer to the middle of the orange area, which is great. Total number of new cases today, 302. New cases today, 7-day running average, 303. That's a good number. The doubling rate, 48.8. Remember, we were down at like 15 or something just a few weeks ago. So we have brought the curve. We need to bring it down. We need to actually now decrease the virus load. Cities around the world, and certainly in our country, have communities like ours that are able to do this when people are scared. They're able to do it when they see the fear in the eyes of the emergency room physicians about what could happen to the ICUs. The question we have in our community right now is, can we do it when we're not scared, but when we're trying to make conditions better? Can we do it knowing that we're going to have to do this for months? We're going to have to do this indefinitely. Can we still do it? Because frankly, we have to. Let's look at the other numbers. The 7-day running average on hospitalizations is 469. The number of people hospitalized tonight is 453. It's lower than the 7-day running average. That's a good sign. That means hospitalizations are beginning to slow down. Now remember, we have a case. And then after we have a case, then we have somebody that ends up in the hospital. But we see it first in cases. Then we see it in hospitals. And after they're in the hospitals, then we see it increase the ICU numbers. And then when we've seen it increase the ICU numbers, we then see it later increase the ventilator numbers. And then later than that, we see it show up in deaths. So the first number that we should be reeling in would be our case number, new cases. The second thing we should be reeling in would be the hospitalization number. The next one we should see us reeling in would be ICUs. 7-day running average on ICUs, we have 160 people in our ICU. So our ICU number is still going up faster than the 7-day running average. We're now better place on cases, better place on hospitalizations. ICU still going up. Hopefully we'll reel that in as well. Excuse me, ventilators. 7-day running average of 106. There are 111 people tonight in our city on ventilators. So we're going to have to reel that one in. Dr. Escott talking today wanted me to make sure that everybody understood we are not out of the woods. In fact, we could be seeing, we have to keep our fingers crossed, it's in this next week when we'll see whether there's a spike or a surge associated with July 4th. You know, it takes up to 14 days for somebody perhaps to get the virus, to have it incubate and manifest itself. Might take another week before they end up in the hospital. So about 3 weeks maybe after somebody gets infected before maybe they show up in the hospital. July 4th, 3 weeks. That would get us to July 25th. Today we're July 22nd. So we're not out of the woods yet. We have to see those numbers. Hopefully we can hold on to the numbers. Hopefully people were paying attention on July 4th. Why don't you go to the next chart, Anita? This is the one that has the numbers in green in the middle that I just gave you when we were looking at the 7-day running average. Oops, there was a second dashboard we skipped past. The second dashboard had the in green the three numbers that we talked about. That was the daily number. On the other dashboard, we had the 7-day running number. But what you just saw that just disappeared, that could come back to us in a second, Anita, kind of disappeared there for a second. There it is. The three numbers in green were the daily numbers. We've gone through the 7-day running numbers. Off to the left, you can see in white, 18,696. That's the number of cases that we have, and deaths at 222. That's an increase of 4 people over yesterday. Those are the numbers from that chart. The admissions to the hospital, if you went to look at the detail on that page, would show you that while Hispanic share of hospitalization had reached almost 70%, it's now gone down for the last 2 weeks, and it's in the low 50%. Still too high, still disproportionate to the number of Hispanics in our community, but at least that number is headed in the right direction. All right, let's take a look at the chart. We're going to move away from looking at Dr. Escott's chart to looking at Dr. Myers' chart, just because it has a little bit more information to it. And we'll just show this one segment from her website so that you can see. That is the chart of new admissions. The dots are the actual numbers. The green line is the 7-day running average. You can see that the number is starting to come back down. This is a better version of that chart that you see. If we could lose that label here for just a second so you can see it. There it is. So that you can see that chart that had the colors on that on the dashboard, first dashboard. This is the actual chart that is kind of cartoonishly put on the dashboard page. This is the actual chart. Dots are actual numbers. The line is the 7-day running average. You can see it takes us up to yesterday's number. You can see the green line off to the left that tells you what the mean is of all the different possibilities. We still have to be prepared that we could end up on one of those spaghetti lines that head up, because that's possible. But at this point, if we keep doing what we're doing, it's not likely. But notice that number doesn't go, the mean line doesn't go down. It's basically plateauing. We would expect it to plateau for another couple of weeks, and then we would hope that it would start going down, assuming that everybody still maintains the same behavior. At the top of that page, you can see the reproduction number is at 0.78, and we had to keep our eye on that number because we want that number to go down as well. In April of this year, I think we got to a 0.55. I think that was the lowest number that we were able to get to. Okay, those are the numbers that we have for today. I want to remind people that this Friday, July 24th, is the deadline for applying to some of the city grants to small businesses, to nonprofit organizations affected by COVID-19. So make sure that you apply. Go to atxrecovers.com. Applications for grants for child care centers are going to be open until October, or until we run out of money, whichever one of those comes first. So I urge everybody to go there as well. atxrecovers.com. 2 more states have gotten on board on masking. Republican Governor Mike DeWine in Ohio just announced that all residents are going to be required to wear masks in public starting tomorrow. And the Republican Governor of Indiana, Eric Holcomb, announced a statewide mask mandate to go into effect on Monday. That's great to see. It is so amazing to me that it has taken this long. Now that more and more states are implementing masks, they're seeing the same kind of thing that we're seeing here in Austin. We did it with great discipline, and we did it relatively early compared to some of these other states with Republican governors that did not let their cities make mandatory mask provisions and didn't come out with mask mandates. They're trailing, but hopefully they'll catch up. The national estimate for deaths in the United States that had been going up is now starting to come down as well. It's well over 200,000 total, but it's coming down now, mainly, I think, because there's greater mask usage around the country. But again, if you wait too long and you don't show the discipline, you can get stuck. Out in Los Angeles right now, they're discussing whether or not to issue a second shutdown order. And that's a scary thing. Today, I just want to touch base. Tesla announced today that they were coming to Austin. Could be construction of at least $1 billion. I'm excited that Tesla has selected Austin. Apparently, there were lots of other cities and places that wanted to be the home for the Gigafactory. Could be the largest factory of its kind in the world. You know, when we were sitting down with all the workforce development stakeholders in the city a year, 2 years ago, 3 years ago, trying to decide and talk about what it is that we would most want to have happen come to our city, it was manufacturing. It was clean manufacturing, because this is Austin. It was clean manufacturing that would bring thousands of middle skill jobs. Those are jobs that don't necessarily require a 4-year degree, a 2-year degree, or a certification. You know, Austin, had plenty of jobs that were paying 6 figures and up. We're blessed to have those kinds of jobs in this city. And then we have a large component of jobs that are service jobs that are where people are at that end of the spectrum. What we don't have is the middle jobs in our city, so that people can move from jobs that are not paying a living wage into jobs that are. So to have a clean manufacturer coming in with middle skill jobs that are going to pay a living wage, thousands of them, and then to locate in the Eastern Crescent, so that we can start creating even more economic engines on that part of town and in those communities. This is, in so many ways, the kind of thing that we were hoping would find its way to our city. Not a done deal yet at the city level. Still have to work through the approvals in the city of Austin, which hopefully will get here as soon as Tesla brings their permits and their plans to the city. Still some labor issues that we need to clarify, but I'm excited that that's going to happen. And then, just touching real quickly, there was a large public meeting today about Project Connect. Plan laid out after 2-3 years, a really intense community discussion debate. The plan has changed over that period of time in response to what was being heard from the community. It's probably something that the city council is going to consider, along with the Cap Metro board, probably on Monday. There's a joint session. Here's one plan. It's not the 11-cent plan that had been discussed in public, but there's discussion now about a smaller investment that would only be an 8.5-cent plan. This initial investment still is how we deliver the entire system to the city. There's the map on the right. Kind of looks like a transit map that you would see in big cities that are big cities and actually provide equitable transportation to the people in their community. It would be great if Austin could join that. You know, it's a plan that addresses traffic congestion and expands equitable mobility for essential workers in our city, reduces greenhouse gas emissions. It's going to decrease traffic fatalities and injuries. It's going to provide high quality connections to jobs and to education and to healthcare. It's going to be something that actually goes out to the airport and gives you a way to get in from the airport without a car. It's going to have investment in affordable housing and other measures to prevent displacement of current residents that are along, and businesses that are along the transit routes. My hope is, and my expectation is, the council will add some money on displacement and on equity. I think we have a chance to be the city that contributes more than any city in the country ever has at the threshold, at the initial authorization for a transit system in the city, that we will put in a greater investment to mitigate displacement than any city in the country ever has, because I think that's really important and key to the values that we have in our city. It's going to include both fixed rail and buses and roadway improvements. It's going to have park and rides. It's going to have neighborhood circulators. It's going to have money for sidewalks and bikeway improvements. And it's going to have an independent oversight board. Pay attention to the conversations here over the next week. Please go to the Cap Metro website to weigh in. I'm just real excited. In 30 years, it seems like people have been talking about congestion in this city, but we have a chance to do something about it. We're in the middle of a virus right now, and people are hurting in our city, both from the virus and from the economic impacts. But there will be a day when we get past this virus, and when we do, we need to exit this as a stronger, better city than even we went into it when we did. And one of the ways we do that is we have projects like Tesla, like Project Connect, that are going to deliver us jobs at a time when we're going to need it the most, but also help deliver to us a kind of future that has greater access and opportunity for everybody in our city. That's why I'm really excited about these two things. All right, so we're going to conclude tonight by talking about Carolyn. Carolyn wrote me to say that this getting through this pandemic at home with a 5-year-old and a baby was pretty exhausting and overwhelming, pretty challenging. I know what that's like, because in my home right now we have a 6-month-old and a 2.5-year-old. So I know what that's like. Carolyn says that Zoom camps and costumes have helped. And she called the above ground pool an emergency purchase. This is what it looks like in Carolyn's home. This is the 5-year-old in their home, and this is the baby in their home. Both incredibly cute. Carolyn, you're pretty lucky. Carolyn tells us that her 5-year-old wakes up in the morning and immediately announces, "Another great day," which, how could it not be when it starts like that? Hey, you all take care. Take care of yourselves. Good night and be safe.